Hello everyone, and welcome to this webinar on Lessons Learned from Promise, Implications for Policy and Practice. My name is Jessica, and I'm a Y-TAC team member. Before we begin, let's go over a few things. On the right-hand corner, you're able to download our PowerPoint presentation at any time, along with our VR Toolkit SSI Youth Flyer and our policy brief on building state VR planning capacity. Below that is our links box. You can sign up for our Y-TAC newsletter at any time during our webinar. And at the end of this webinar, we do ask you to participate in our evaluation. We'd greatly appreciate if you could take 3 to 5 minutes to complete this after the webinar. It helps us ensure that we're providing high quality training and technical assistance by completing it. In the Q&A box, you can ask your questions to our presenters and we'll answer them for you. And in the right bottom hand corner, feel free to participate in conversation with everyone else. You can introduce yourself here. And that's it. I hope you enjoy this webinar.
Thank you, Jessica. This is Wendy Quarles. I'm one of the project directors of the VR Y-TAC. I think a lot of you who have joined us have heard me do my spiel, so I won't take a long time doing it. But the VR Y-TAC is one of the technical assistance centers funded by the Rehab Services Administration, or RSA. We are led by the Institute for Educational Leadership's Center for Workforce Development, and we have a partnership with Cornell University, Boston University, and a team of key subject matter experts from across the country. Just a little bit about IEL, our home organization, and I've said this a couple times when I've been on the line, is check out the amazing resources at IEL. IEL is located in Washington, D.C., with the main goal of preparing leaders to work across boundaries to make sure that we are addressing systems and networks to focus on children and youth becoming contributing citizens and creating leaders to work with children and youth. We're focusing on equity and impact, leadership and engagement, and specifically a topic that's near and dear to our hearts is transition, disability, employment. And like I said, be sure to go to the website there that's listed below to see resources. We're best kept secret with lots of free information to help us do the work that we're charged with. The key services of the Y-TAC is that we are working with systems to help VR agencies specifically find and engage youth with disabilities who are not specifically in special education, and also youth who are now being called opportunity youth in the homeless, foster care, and juvenile justice systems, to make their way back to voc rehab and make the journey to employment. We've featured at the bottom of this slide, and I'll wrap around and talk about it at the end, the just-in-time toolkit online. I do encourage you, it's one of our newest toolkits that we've put out at the Y-TAC, to take a few minutes to look at that and get back to us at the end of this presentation through your evaluation or through the many mechanisms we've given for asking questions if you have any questions or would like more training and technical assistance on any of the tools that we're referring to today. We are fortunate at the Y-TAC to be a part of a network of sister TA centers and initiatives that are focusing on WIOA-related activities and supports and systems and services needed to help youth and students be successful on their journey to employment. So I always like to feature that group of people, because I've been learning lately that we are some best-kept secrets, that people aren't as familiar with our goal to disseminate information and to provide comprehensive training and technical assistance. So I always remind people of this network of TA centers, and again encourage you to contact us if you have more questions about the work that we do. Um, as with any federally funded program, one of our goals is to collect evaluation data. It helps us learn how we're doing at meeting your needs. It helps us learn specifically how we did in today's event in hitting the topic area that we told you we would. And most importantly, and of great interest to me, it allows you to tell us what topics you still want training and technical assistance on. We've provided the link a couple places in the PowerPoint, and Jessica, who you heard from a few minutes ago, will be communicating through email right after the webinar, and then we'll do a couple reminder emails. We look forward to hearing from you in telling us how we can bring you the information that you're looking to support youth and students in their journey to employment. And I think we've talked about the success strategies for today's session. Technology is a beautiful thing, and we will do our best to maximize all the technology we have here, but we also leave you an email there on the bottom. Please send any of the questions you have, and I'll make sure they get to the presenter that it makes the most sense to. And we keep a copy of the transcript so that if we weren't able to specifically hit on your questions, we will loop back around and communicate with all the folks that have joined us today. And one of the ways that you can hear from the Y-TAC is by clicking on that link that we've provided a couple times in terms of getting our newsletter. It's the way we advertise what we're doing and information that we're putting together. I do see, and I imagine that Thomas will be talking about it, we did put a link to the Mathematica resource report, which contains great information pertaining to the topic that we've talked about in the previous two webinars, as well as subjects for today's webinar. Without further ado, I'm going to toss it to Thomas and the panel of speakers, and I'm just going to thank everybody for joining us. And Thomas, take it away.
It is great to be back with everybody for part 3 in this 3-part web series focused on working with youth who receive supplemental security income and building state vocational rehabilitation capacity to serve this population better. Today I'm so excited because you are going to get to hear from some of my favorite people in the country that have been working around SSI youth issues for quite a while. As you know, domestically here in the United States, we have a rich history of utilizing research demonstrations at a national level to try to identify more evidence-based practices to working with the population of people who receive public entitlements and benefits like supplemental security income, or SSI, or Social Security Disability Insurance, SSDI. Going back to Project Network, way back in the 70s, up to the state partnership initiatives. We went through a couple iterations of work incentive grants out of Department of Labor and Medicaid infrastructure grants. And then most recently, we had the Youth Transition Demonstration that was sponsored by SSA. And now currently, wrapping up its 5th year, going into a no-cost extension year, is Promise, promoting readiness for minors receiving supplemental security income. And so today we're going to be focusing on that. We're going to be focusing on translating some of the lessons that our various state partners that have worked on this initiative have learned over the course of implementing the project. And joining me today is Ellie Hartman. She's a senior scientist out there at the University of Wisconsin-Stout, the VR Institute there. And Ellie has worked across several Social Security demonstrations and is not new to this arena of systems change. Also joining us, and this is the order that they'll be presenting, is Jade Gingrich. She's our project director of our Maryland Promise project. Jade is there in the governor's office and has been doing some remarkable things in the state of Maryland, prioritizing transition-aged youth and ensuring that there are supports and services available within that state, and a new center that maybe she'll be talking about a little bit later that she played a pivotal role in getting the governor's office to sponsor. And then last but not least, my very good colleague Zandy Sink, who's the deputy director of New York State Promise, and his partner in crime, Jessica Ellett, who is our project coordinator here at New York State Promise, are going to share about their experiences here in New York State. But before I turn it to them, I just want to kind of take a step back, because maybe there are some people out here that are listening to the broadcast today that aren't familiar with what Promise is and what it is seeking to achieve. Promise utilizes a randomized control design approach to doing the research that they're doing, where there was a specific set of interventions that the feds were interested in seeing tested in various locations with a very finite targeted population of youth who are on SSI. 6 demonstration sites were identified nationally. Wisconsin, we've talked about. New York and Maryland, we've talked about. But we also have demonstration sites in California, Arkansas, and then a multi-state site with the Aspire project. And the purpose of these grants was to improve the educational and career outlook of youth who have disabilities and receive SSI, advancing goals of fostering interagency collaboration at the federal and state levels to improve services and to actually drive innovation. So while there were required interventions or core services that each of the states were required to implement, in addition, states used some various approaches to how they implemented that, as well as how they maybe added some additional tertiary services and supports to the mix. Each site was awarded originally $32.5 million a year for a 5-year demonstration, and as I said, we're currently in our 6th no-cost year extension. And Promise is a federal and state partnership between the Department of Education, the Social Security Administration, Department of Labor, and the Department of Health and Human Services. And you know, it's interesting from my own personal story. This is a research demonstration being affiliated with New York State Promise that I came into thinking that I knew a lot about this population, and have learned over the last 5.25 years that there's still much that we need to learn. So join me in welcoming our presenters today. And Ellie, I am just so excited to hear about some of the things that you've learned there in Wisconsin, and I'm going to turn it to you to talk to us today. Ellie?
All right, thank you so much, Thomas, for that introduction and getting everyone up on the same page. My first slide here highlights how we implemented Promise in Wisconsin. Although a lot of these pieces were core pieces in all the states, each state implemented based on what made sense with their state structure. So we enrolled 2,024 youth ages 14, 15, and 16 receiving supplemental security income and their families in Wisconsin Promise. And as Thomas mentioned, it was a randomized controlled trial, so half continued to receive services as usual. We even provided a fact sheet to remind folks of what that was. And then half received the Wisconsin Promise services for at least 2.5 years. And that the way it's designed in Wisconsin is they automatically enrolled in voc rehab, which they're eligible for because of SSI. They're on SSI, and we are currently have no wait list for Category 2, so everyone could join right in and be served as a VR consumer, and then also receive Promise services both for the youth and for family members. It was an interagency collaboration at the federal and at the state level, so we made sure that happened also at the local level. So for all youth, they had interagency resource teams. Employment service was a key service, and our aim was to provide at least one paid job for every youth in the Promise Services group, preferably 2 prior to exiting high school. In addition, they're receiving SSI, so work incentive benefits counseling was a key piece to talk about the work incentives involved, how work and benefits interact, and how you can increase overall income and assets through work and through better understanding benefits and ensuring to report earnings as they come. Financial coaching in addition, so not only the benefits piece, but a lot of our families living in poverty. So how do you build assets, budgeting information, stretching the dollar, helping to increase that income, what do we do with that increased income? Because we were working with both youth and the family members. And then pre-employment services as well, those pre-employment transition services. Promise came along right around the time of WIOA, so that those social skills training right away for job-related skills and empowering youth and families through family and health advocacy. And then in Wisconsin, we also added health promotion. So as Thomas mentioned, I think we all came in here thinking, oh, I understand what's going on with the youth receiving SSI, that population and their family. And I think we learned the population was a little different than we were originally thinking. I think a lot of folks were thinking folks with significant health care needs, and that is a portion of the population, but not the total population. To receive SSI, they've both had to have a disability determination, and their household income had to be deemed low enough. So many of our folks were living in poverty. And what we know about poverty, that there are certain factors that could influence connecting to services and supports. A couple pieces from behavioral economics includes scarcity is distracting, and so those with limited resources, your focus is more on obtaining those, and the focus is there versus, okay, how can I change these things over the long run? So even though we knew that a lot of youth and families were eligible for a lot of services and supports, we quickly found that they weren't connecting to those services and supports, which makes a lot of sense when you start to really think about it. Living day to day makes it difficult to go through all the required steps, always following through as our service systems demand, even navigating which door to go in. And as much as we like to think we're flexible, there's pieces that could definitely be better geared towards youth and families. This is a big piece that we found. Things to think about is, are we taking into account trauma, basic needs, ambivalence, so folks not quite sure, they've got the everyday needs, do I really want to make this change, or is employment the right thing for me? The training structure, talking about theory and hypotheticals, might not be the right place to start. More hands-on practical instruction, meeting folks where they're at, makes a lot more sense for folks, and making it more relevant for today really brings the services to where people are at. So in Promise, just a sense of the population, we saw 34% of our Promise youth identified their primary disability as mental health related, 30% intellectual, 25% other, so like learning disabilities, ADHD, other types of disabilities. And then there was a smaller percentage of physical or sensory or traumatic brain injury, things like that. They were smaller percentages. Overall health status was reported to be good for most youth living in single-parent households with lower income. 2/3 of Promise youth are male, and that's consistent through, I think, projects. And then race and ethnicity, we're talking Wisconsin here, 49% statewide African American, and that was 78% in Milwaukee, 36% white, 8% in Milwaukee, and then overall statewide 10% Hispanic.